As we approach Overdose Awareness Day on August 31st, we're shining a spotlight on the toxic drug crisis that continues to devastate communities across Manitoba and Canada. Since 2016, more than 52,000 people have died from an apparent opioid toxicity, an average of 20 lives lost every single day. The Rapid Access to Addictions Medicine Clinic assists people with substance issues in our community. Dr. Erin Knight, the medical lead for RAAM, joins us now. Good morning, Dr. Erin.
Good morning.
Tell us a bit about RAAM for folks who aren't familiar.
Yeah, RAAM clinics in Manitoba opened starting in 2018, so we've been around for a few years now. Really, the concept is low barrier access to addiction care. So every RAAM clinic across Manitoba has an interdisciplinary team. We have walk-in hours, and people can just walk in without an appointment or without a referral and see anybody as part of our team. So that might be the physician, the nurse, the counselor, sometimes a peer with lived experience as well.
What's been the most integral piece of it?
I think the biggest piece is just the accessibility today for not only a medical assessment, so for medications to help with cravings and withdrawal, but also to be able to do referrals to either detox programs or treatment programs all in one visit.
Yeah, so how does that work if somebody is interested in seeking help? You'll refer them to other agencies? You work close together?
Yeah, we work closely with all of the treatment agencies within Manitoba, mostly with the publicly funded ones, but there are some private ones as well. So if people are requiring withdrawal management services, we can ensure that they get connected to the right level of service. And if they're looking at going into like a live-in treatment program, we can arrange that as well, and be able to provide some support in the interim while they're waiting for that.
I mentioned some numbers off the top. It's difficult to stomach. This is something that is challenging so many parts of our healthcare. In Manitoba, what is the state of it right now?
We have, unfortunately, in Manitoba, continued to see rises in substance-related deaths year over year. We have relatively recently gotten updated numbers for the total number of substance-related deaths in 2023. They're the highest we've ever seen, at 568, which is comparable to other places within the country that are having crises related to substance use. So we don't see ourselves in the news so much related to substance-related deaths, but we really are being impacted by the same level of crisis.
Would you say part of that's because of the stigma?
It can be, certainly in terms of preventing people from accessing care or preventing people from talking to their loved ones about what they're struggling with. Part of it is also that we're dealing with a very toxic drug supply currently, and so even people who don't necessarily have a substance use disorder or really problematic substance use are still at risk of drug-related deaths because of the toxicity of the drug supply.
With the Overdose Awareness Day coming up on the 31st, before we're at a time here, anything else you want people to know, really?
Yeah, I think certainly for people wanting access to treatment, RAAM is a good place. For people who are just using substances and aren't ready to change that, just making sure that you're using in as safe a way as possible, accessing things like drug testing that are available within Winnipeg, making sure you have naloxone kits, and making sure that the people around you have them and know how to use them as well.